So, we're going to talk about drugs. There are some drugs that are good for our bodies, that are healthy, that can make us healthy. In fact, right now we have a lot of pharmaceutical companies that are trying to figure out some good drugs that can cure the coronavirus. So, a drug is a chemical that affects your mind and body, and it affects the way we walk, the way we talk, we think, and we act. And some drugs are illegal, while others are legal. Here's some things that you can get over the counter. That means that you can buy them without a prescription, without a doctor's authorization. So, aspirin, Benadryl, allergy pills, vitamins, usually, these medicines, we call these prescriptions, are given by doctors. And they're for certain people and certain ages. They help keep us healthy. But one thing we want to be careful of, these cannot be shared. And usually on the label, it will tell who the medicine is for. And then the doctor will say how many tablets or pills that person should take a day. But if you take something that is not prescribed for you, then that can harm you and kill you. So you only really want to take medicine when it's prescribed by a doctor, and really when your parents say that it's okay. So we're going to talk about a legal drug. It's called an opioid, and an opioid is actually a pain reliever that is prescribed by a doctor to help people deal with pain. Maybe they have had surgery on a knee or a shoulder, and that's okay because it's prescribed by a doctor. But the challenge is that opioids are very, very, very addicting. It's kind of like opening up a potato chip bag. It's hard to have just one potato chip. So, what happens is some people will start taking the opioids prescribed by a doctor, and then the prescription runs out and the doctor will not fill it. The doctor might say, well, now you can go down to something that's a little less powerful, like an aspirin or Tylenol or Advil, which you have probably taken before. But they really want that stronger pain reliever. So then sometimes they go to the streets where they get these opioids illegally, and they're very expensive. And then you can see where I'm getting. And then they need money to buy these opioids. So they start stealing. And then somebody else comes to them and might say, well, I can give you this illegal drug like heroin. And then it just starts this big cycle of these illegal drugs that are very, very bad for you. And there's an epidemic in Ohio. It's getting better. But in the year 2016, you can see some of these numbers here. There were a lot of, people, teenagers and college kids and other people in their 20s who were really addicted to opioids, and that's just not a good thing. And again, if something is not really prescribed by a doctor or your parents don't think that it's okay, you should not be putting anything into your mouth. Always know the food and things that you're putting into your mouth. We should never, ever dare someone to do that. So let's talk about alcohol. As you know, you have to be 21 years old to buy it. Grown-ups are allowed to drink. Of course, we don't want them drinking every single day. But kids, you don't want to do this because you can get dizzy and really sick to your stomach. And a person who drinks too much really should not get into a car because it alters their state of mind. They can't walk straight. Sometimes they talk in a funny way. It's almost like your brain is going to sleep. Now, it is okay with some religions. Sometimes they give you a little sip of wine if you're doing communion or different religious ceremonies, and that's okay. So let's talk about tobacco. Let's talk about tobacco products. Smoking you used to be able to smoke. Anyone used to be able to smoke years and years and years and years ago, and people did not think that it could hurt your body. But now we know, because of lots of studies, that on every pack of cigarettes, you can see the Surgeon General's warning: smoking causes cancer, heart disease, emphysema. Every cigarette pack has a warning on it. And the problem is, there is a chemical in the cigarette called nicotine that makes it very, very addicting, kind of like those opioids. And if you talk to most cigarette smokers, they do not. They don't want to be smoking. It's just that nicotine is so powerful in their bloodstream that it's saying, I want more, I want more. So the best thing to do is never, ever, ever start. And look at these diseased lungs. This is crazy. This is normal. This is some lungs that have emphysema. That's when it kind of clogs up all these little alveoli sacs all over. But look at the smoker. Now you can see why these two diseases are killers for sure. If you have somebody that you know who is smoking that you're worried about, then you can always encourage them to talk to their doctor. There's some medications that they can take as well. So let's talk about what do you do if somebody dares you to take a pill? Remember, you need to have a plan A and B. Are you going to say no? Are you going to give the consequences? Do you have an exit strategy? If you're at somebody's house and they want you to make a bad choice, what are you going to do? Are you going to change the subject? Are you distracting? Are you going to say, I'm not going to go down with you because my mom and dad would be really angry? So you need to have that strategy and you need to practice it. What are you going to do if somebody dares you not only to take a pill, what if they dare you to take a puff of a cigarette or some alcohol?